We'll start, Aaron.
Perfect. Go ahead, Catherine.
All right, thank you. All right, good morning, good evening, good afternoon in the Pacific. I welcome you all to this great show. First, let me thank Aaron for his fantastic idea of bringing us all together to know about the highlights of the conference. It's such a great idea which has connected all of us, and it's a great beginning to the conference. And I did have logged in for some sessions, though not too late night, and it was very great to see the panel discussion that Clarissa was hosting. Right. Again, as I said, this is a great opportunity for the colleagues in South Asia, East Asia, and Pacific to get the benefits from this conference. The experiences and key learnings from this conference is shared by the host organization representative, and today's host is Aaron. For all of us, have a great privilege having Aaron here on the show. And then FANSA representatives will be co-hosting this show along with the representatives of University of North Carolina. And this helps us to bring the events highlights of the day. And then the guests from South Asia will reflect how we can contextualize this to the South Asia and Pacific context, and we can have deliberations of how this can be adopted to the Asian and Pacific context. And it's a great honor and privilege to welcome you all to this show. And then I'm looking forward and very excited that we will have a great 45-minute show from now on. And thanks, Aaron, and over to you to just briefly explain. Maybe I think I'll go to Kendra first to have the introductions of everyone. Kendra, over to you.
Thanks, Neha. Hi, my name is Kendra DeRusso, and I'm the Country Director of World Vision Vanuatu. I suspect many of you are saying Vanaware, and Vanuatu is a really small archipelago in the South Pacific. And what I thought I would do for the introductions is ask each panelist to say their name, the organization that they work for, where they're physically at, what time is it, and how do you say water in a language that isn't English? So before I go through the various panelists, I do want to make a 2-second plug for a really important study that is a first of its kind in Vanuatu, which was done with World Vision and the London School of Hygiene and Tropical Medicine through the Water for Women Fund. And I can see quite a few attendees from the Water for Women Fund on. And with some national partners from the government of Vanuatu. And it went to 54,000 individuals around Vanuatu to look at access to water, particularly for people with a disability, menstrual hygiene, and continence management. And I'll pop the link to the online study into the chat later. So back to introductions. As I said, my name is Kendra. I'm in Vanuatu. I'm the director of World Vision here. And it is 2 p.m. And one of the ways that you say water in one of 125 of Vanuatu's languages is why. So can I ask Pasang, can you introduce yourself next?
I think he mentioned he was driving into the office, so he may be in transit from his car to the office.
That's fine. Aaron, will you introduce yourself first then?
Sure, I'm happy to. So I'm Aaron Salzberg. I'm the director of the Water Institute at the University of North Carolina. And right now I am in Chapel Hill, North Carolina. And it's 11 something p.m. It's been a long day. We've been running the conference since about 9, 10 o'clock this morning, but it's been a great and exciting day. And I'm going to cheat because I'm going to steal Sneha's word for water, which is pani.
Very nice. Jenna, how about you next?
Sure. I'm Jenna Davis. I'm at Stanford University in Palo Alto, California, which is where I am now. It's a little past 8 p.m. for us, and the word maji is water in Swahili.
Thanks. Dr. Kadaka.
Did you refer my name, Manohara or Khadka?
Yes, yes.
Okay. Hello everyone. Good morning from Kathmandu. I'm Manohara Khadka. I work for International Water Management Institute. I am a country director, a very exciting institution in terms of looking at water issue from social and biophysical science. What I do is we have a very important project supported by Water for Women. We are looking at gender, how social gender power relation impact access to and functionality of water that we are going to share today. To you, very much grateful to be part of this discussion. Water in Nepali also is pani.
That's great. I'm hearing some linguistic similarities. And I think last, but certainly not least, Manita.
Hi everyone, this is Manita Raut. I also work with Manoharaji at International Water Management Institute. Right now, I'm joining from Kathmandu. It's 8:55 a.m. in the festive morning of Dasai here. In one of the indigenous languages, water is called pine, which is similar to the other linguistic similarities that we've been witnessing. Excited to be here.
That's great. Thank you. It seems like maybe Pasang, would you be willing? Are you available to introduce yourself?
Oh, yes. So sorry. You should tolerate Bhutan's internet connection and all. Okay. My name is Pasang, and I am the executive director of Bhutan Toilet Organization. And water in Bhutanese language is called chu. Yes, chu. So simple.
So simple, but so important. Thank you very much.
Yes.
Sneha, I'll hand back over to you.
Thanks, Kingdar. That was fantastic. I think let me also introduce myself. I'm Dr. Snehalata Mekala, and I work as a regional coordinator for FANSA, Freshwater Action Network South Asia. Freshwater Action Network South Asia is a network of 400 plus CSOs working in 8 South Asian countries in this part of the world. And I stay in Hyderabad, a South Indian city, and the regional secretariat of FANSA is also hosted in Hyderabad, hence I live here. And the time is 8:42 a.m. in the morning, and all my colleagues must be still bringing their breakfast and eating, and I hope they're all watching this show here. And it's a pleasure to be here. And water is called in my regional language, Telugu, as Niru. Right. Now, let me go over to Aaron to give us the overview of the show and also the conference a little bit. And then we will move in from there after Aaron's intervention. Aaron,
Well,
over to you.
Sneha, Kendra, thank you so much for the introduction and being able to do this and pulling this together. I know you said that we're doing this for you. It's the other way around. We so badly want to be able to engage the Asia and Asia Pacific region in this conference and in the work that we're doing and make sure these voices can be heard. And so just to have the opportunity to hear from all of you and to bring you into this conference, that's a really important thing for all of us. So we really appreciate that all these folks are taking the time to do this. You know, for those of you who don't know, just to introduce the conference a little bit, the UNC Water and Health Conference is the largest annual international meeting on drinking water, sanitation, and hygiene. And the goal of the conference is really to review the evidence and interrogate the science on WASH issues to inform our work both in policy and in practice. And so what we really do is try to create events where you can let the practitioners engage with the scientists engage with the practitioners, with the policymakers present, so that we can best inform the work that we do in the field. It's really a unique meeting, and we're really excited that we're able to host this at UNC. This year, we're focusing on 2 themes. We usually pick 1 or 2 themes that we highlight through the plenary events. And this year, the 2 themes were relatively easy to pick because they almost picked themselves. The first was is SARS-CoV-2, the virus, of course, and the disease that it causes, COVID-19. And then the second issue is around systemic inequalities and how the work that we do may be contributing to exacerbating systemic inequalities in places throughout the world. So 2 critically important issues that we'll be exploring through the plenaries. We have over 3,000 registrants to the conference from more than 130 countries. This year's conference is virtual, so all the content is available online. And in fact, if you'll just give me a quick second, what I'll do is I can show you the conference website so that you all have a chance to be able to go on and access some of this content and you know where to go. And so what'll happen is if you go onto the website, and this is the place that you go once you click on the registration, it's relatively easy to navigate. If you go to the agenda tab, you can then pick the sessions that you'd like to look at. And there are really 3 general types of sessions at the conference. We have plenary events where we're engaging everybody at once. We have side events that are talking about specific sets of issues, where usually about 3 or 4 at the same time. We have verbal technical discussions where we're talking about the science and scientists are presenting the latest research. We also have poster sessions and a couple of special sessions. So you're welcome to check any of these out. If you click on any of these, like the plenary events, what will happen is those events will pop up and then you can choose the event that you'd like to look at. And once you do that, you'll find that there's so here's the session that we did, in fact, this morning. Well, actually, sorry, this is tomorrow. This is Wednesday's plenary events. We're going to go ahead and move up a little bit. But if you go to today's plenary event and click on that, what you'll find is that it'll open up to a new site and there'll be the recorded video of the session. So you'll have access to all that recorded material at your leisure so that you guys can engage just like everybody else at the conference. There are a couple of other features I'll just point out. There is a virtual exhibit hall as well. Our sponsors have set up booths where you can go and see some of the work that you do. World Vision, Kendra's World Vision is one of them. And so they've got a special exhibit here as well that you can stop in and see and take your time and enjoy all the content. So again, a really rich site, and we've done this on purpose in the hopes that those of you who aren't able to enjoy this live and be there in person can really experience it and get a full flavor for the conference. And so we're really hoping that you'll be able to take part of all the recorded content. Today was quite an exciting day, and Jenna will talk a little bit about some of the key highlights. But what I'll do is maybe just show you a couple of. There were really 3 prime events that happened today. The first was around the first full plenary event that we had was around COVID-19, and what we did is we talked about the science of the SARS-CoV-2 virus and COVID-19. We really wanted to lay a foundation for what's our understanding about how the virus behaves, how we get sick from the virus, what we can do to disinfect things from the virus. And it really was to create a common foundation of our understanding of around the science. We then moved to the plenary discussion that Sneha mentioned. Clarissa Brocklehurst chaired that conversation. And this was really about the state of the response, how different major organizations are responding to the COVID-19 epidemic. And of course, we have WHO, we have UNICEF, we have Ethiopia, we have lots of representation from a lot of different kinds and flavors of organizations. So we can get a sense of how the world's really stepping up and responding to this. And then finally, to close out the day, we had 3 separate side events, one that dealt with COVID-19 and hand hygiene and hand washing, COVID-19 in healthcare facilities, and of course, COVID-19 and wastewater management. And so that was the general structure of the day, and that's the general structure of the conference. Sneha, I'm happy to go however way you'd like to do this. If you'd like to open for questions now, or let's hear Jenna's views on key insights from the day, and then we can open it up and take questions.
I would suggest that we hear from Jane, and then after that we will come back for the questions. And meanwhile, the questions which are there in the question and answer box, you can also type some of the answers in there.
Perfect.
Over to you, Jenna, to give us a reflection of what were the key, the salient features that you found in day one's conference. Then we will also go through others if they have any inputs after that. Over
Thanks
to you,
so much.
Jenna.
Thank you so much. And Aaron, I just want to confirm that you are interested in my broader comments about the pandemic and the conference, or would you rather that I save some
It's
of
an
that silly
informal
stuff
program.
till later?
You're willing to do whatever you'd like.
Okay.
But I think they'd enjoy seeing your broader comments in addition to any insights you got from the conference.
Perfect. Okay. So, you know, as we were thinking about this session, I reflected on, you know, I've been coming to the UNC conference since it started, and yes, it's absolutely true that I value so much being caught up on colleagues' research and practice and policy, but it's also an opportunity to be together as human beings. And that, I think, is one thing that we're all really missing this year, is, you know, just a chance to hang out and be together. So one of the requirements for being on this panel was to have a sense of humor. And so I took Aaron's instruction quite literally. And in an old tradition of US late night television, I created a top 10 list, top 10 things that I have learned during the COVID pandemic. And not just me, I consulted my students, postdocs, my colleagues, but I thought it might be a way to get a few laughs out early and maybe loosen everybody up for a good discussion. So with your indulgence, I will share my screen and see where we go here. I need to do this first.
Should be enabled, I hope.
Sharing has failed.
There's a button down there where in green it says share screen, Jenna.
I did push that. But I got an error message from Zoom saying it has failed. So I might be, let me try it without it on.
Oh, you had it.
Yes,
there we go.
See.
Okay. So, all right. So for those of you who aren't familiar with this tradition, there should be like jazzy music playing in the background, and you should imagine like a laugh track and all of that stuff going. All right. So the top 10 things I've learned or relearned during the COVID-19 pandemic. Number 10, it turns out that there are less comfortable places to work than the middle seat in a 16-hour plane flight, namely what counts as a home office for me right now. Haha, see, get it? Number 9, if you try really hard, you can get to the end of Netflix, right? You can watch everything they've got, as my sons have figured out. Number 8 of things I have learned or relearned during the pandemic, there are so many ways that I can embarrass myself on Zoom during teaching and other things with the help of my family. Number 7, there is such a thing as too much family time. I was really thinking that was the silver lining, but we're coming sort of to the end of it now. Similarly, number 6, I used to really hate to go to the dentist. Now I really look forward to it because the alternative is homeschooling my children. Number 5 of things I have learned during the COVID pandemic, I need to be much nicer to my hairstylist because DIY is really hard. Number 4, nonverbal communication is really difficult to do well if you have to wear a mask. So this is the best I can do in terms of trying to convey my moods to people in public. On a slightly more serious note, number 3, something that I think we're all learning, we talk a lot about resource recovery from waste streams. Right now, one of the most valuable resources we can get from waste is information about caseloads or infection loads in communities or in sewer sheds that can be used to inform public health decision making. Another thing that I think we've learned is that just because you're a country that has a lot of resources doesn't mean you're going to do well in this pandemic. So it obviously takes a lot of other things like leadership and smart planning to be on the lower left-hand side of this graph, which is essentially COVID cases per million population versus GDP per capita, PPP. And finally, I think that I've been reminded that there's really nothing like a global pandemic for us all to realize that we play a really critical role in public health prevention and management as water, sanitation, and hygiene specialists. So yay for everybody. That was all.
Jonathan,
Jenna,
that was great.
Yes, that was fantastic.
I'll only add that for those that are interested, I think that so I was able to moderate that opening plenary, and we did really try to test out some of those ideas about is there infectious virus in wastewater? Is it in fecal sludge? Does it represent a threat to human beings if it does exist there? Does it travel through the air? Can you get it by flushing toilets? These are the kinds of issues that we really tried to tease apart during that opening plenary. And so I think, those are the kinds of things that you'll find if you dig into some of the material that we recorded today.
And on that front, I also thought it was quite interesting in that first session to hear all the ways in which we've been very lucky, right? That this is a pathogen that is susceptible to treatment, right? So, water treatment plants and wastewater treatment plants seem to be doing a good job of inactivating it. Hand washing works, alcohol-based hand sanitizers work. It doesn't persist that long in the environment. And yet it is, collectively whooping our butts. So I think that was sort of an interesting path that we went down this morning.
There's an interesting question in the Q&A about how do we plan to address the WASH issues connected with COVID-19? What are the key issues in the Asia Pacific region? And we did talk a little bit about this. I mean, I think the fact that you're in an environment that's warmer, that's more humid, means that you might have a different set of risks than climates that are colder and drier. And those are things that you're going to need to pay attention to. I think there was no question of the role that hand washing plays, but so was disinfection. I think it was clear that gel disinfection is an important part of dealing with the virus when you don't have access to water supplies, and that's an important approach to dealing with the disease. We did talk quite a bit about environmental issues. So obviously being close together in a packed environment with air conditioning and no windows and poor ventilation, that's a high risk environment. But in terms of surfaces, I'm not sure that was, I don't know, Jenna, you tell me, was that, I don't think there was a conclusive argument that was a high risk, I think, to most people.
I'd agree with that. And I know that there are attendees here that know far more about this than I do, but my sense is that that is not a pathway that people are thinking is, really accounting for a high degree of transmission. Another piece on hand washing that I asked a question about that really had not occurred to me, but thinking about hand washing with water and soap versus with other things. And Aaron, you just talked about ABHS, and there are different mechanisms, right? So you can have mechanical removal of the virus, or you can have inactivation. And so if we knew a bit more about how actually these different approaches are working, then in environments, in contexts where you don't have access to water and soap, you would be better informed about what your next best option is. And so there was a knowledge gap that sort of surfaced that I thought was important.
Well, the idea that maybe we're washing the virus off versus actually inactivating the virus when you're washing your hands. And these are really interesting questions that we just don't have good answers to yet. And I think the other important message was, around infectious dose, and that while we're detecting parts of the virus in wastewater and in fecal waste, finding enough infectious virus that could really cause a disease in a human, that's something that we haven't found in those areas. And so the idea that there is a dose response that we need to identify, we haven't put that picture together yet. We don't know how much of the virus will actually cause the infection and what kind of settings in people yet. And that's something that there's a lot of science that needs to be done around.
Right. And there was a bit of a debate. I recall there's a question here in the chat about what does the latest evidence regarding SARS-CoV-2 in wastewater, and I think there was some debate among the panelists that I think most felt that there had not been evidence of culturable virus in wastewater streams, but a couple of folks thought that maybe there had. But it seems that if it is the case, it's very much the exception and not the rule, suggesting that treated wastewater is probably not a major risk.
Well, I think the consensus of the technical experts was that treated wastewater, there is no risk, there is no live virus in treated wastewater. In untreated wastewater, they've yet to find a culturable, although there's a little bit of a question there, a live culturable virus. But I think the sense was, even if you did, you weren't finding it at high enough levels that it would really present an infection risk.
Right, and I misspoke, sorry. I meant untreated, yeah. Mm-hmm.
Yeah, I mean, that's what I heard from the panel.
Yeah.
And that's where we have to differentiate, because there's a lot of work coming out using, as Jenna was saying, RNA to track communities that might be exposed to the virus. And again, RNA by itself does not infect anyone. You need an intact virus to be able to cause the infection. And we just don't see that certainly in treated wastewater. And even in wastewater, it's very rare, as best as we know it.
Right. I was also, Erin, I don't know where you came out on things, but there seemed to be a heated exchange kind of out in the world about droplets versus aerosol. And right. I felt like the panelists were sort of dismissive of that. And, so it's just a continuum. Don't worry too much about that. I don't know, if you took something different from that.
That's interesting because, the droplet theory, of course, is, somebody coughs and somebody sneezes. So you get larger particulates that then travel through the air and can cause people to get sick. The other is, let's say you've got, solid waste, fecal waste, and that, little particles can come off of it and get aerosolized into the air and float around and make people sick. There does seem to be some discussion about this in the community as to which, the size of the particles that can cause infection. But I'll quote Mark Sobsey here. So Mark is a researcher here at UNC, and Mark said there was one study he was talking about where they actually put an air collection device at the base of a bed of a COVID patient inside the hospital room. And so they sucked in all sorts of particles, they differentiated the particles, they looked for the virus in particles. And at the end of the day, they still couldn't collect enough infectious virus to really infect another human being at the base of a COVID patient's bed. So that suggests that small particles that travel long distances that contain a lot of infectivity potential is probably unlikely. But then again, watch the tape because there are experts on there and I am not that.
Right, more detail.
Discuss the importance or not of, we did, but interestingly enough, the experts didn't seem to feel that concerned about fomite transmission. Jenna, correct me if I got that wrong, but
no,
yeah.
I agree.
And, I think the sense was that there's so many things that have to happen. This is a reasonably labile virus. It doesn't survive very well in the environment generally. So you'd have to get a lot of it on the surface, then you'd have to touch it and get a lot on you. Then you'd have to touch your face and your eyes and transmit that in. And so, and it's unclear how much you have to get on your hands and actually touch your eye with to get the disease. So, but it doesn't seem like, at least, that was a mode of transmission that they were highly concerned with.
That's true, although I don't think we discussed subpopulations very much, right? So, you know, they're young kids, you know, that is how they explore their world. It actually is, so,
Yep.
right. But even that, you
Right.
know, the role of younger people in transmission, that was not, that wasn't a major focus today.
Yeah, it's true. You got to think young kids who are touching each other, touching shared toys and shared environments for sure. I mean, then it's, you know, somebody touches this and 2 seconds later, another kid's touching the same surface the same way. That's a much different type of exposure, I think.
Yeah.
It's true. We did hear some differing opinions on masks, which surprised me. There was a little bit of discussion about whether or not people should wear masks and under what situations they should wear masks. I think that generally, I think people felt if you're in a rural environment where there's good distancing between people and you're in the outdoors and you've got wind and air and stuff like that, the need for a mask was probably less. But if you're in a confined environment with other people for a long period of time, then it absolutely had benefits. At least that was my takeaway. Jenna, you might have a different view on that.
No, very similar. I think the problem with, my take on that is I get it. I think the problem with trying to translate that into general public health advice is that that's a continuum. And so at what point, right? So, you know, inside in a big hall with just a few people, or anytime you're inside, or, you know, because I've been at some outdoor gatherings recently where it was way too close for comfort. So I understand the arguments that were being made, but I also could imagine from, you know, if I worked in a public health department and I had to try and come up with some messaging around that, I would be very nervous, because essentially you leave it to everyone's judgment, right, about where they are on that continuum.
No, I think that's right. Looking at the chat, and that's Kundala Rao. I don't think we know that, and I guess my sense was the panelists were, they made a point to say that we're not sure how much of a viral load you need to actually get the disease, and what level of exposure will make you sick. At least that's what I heard.
Yeah.
This is very interesting discussion between you, Aaron and Jenna. I think you have given very good insight for us, and let us try and look at how the other panelists are taking this in their country context.
Yeah.
Maybe first I will go, but that's really fantastic. You have given us a lot of information, and then there is still a lot of details that we need to know about this virus. And let us hear from Pasang about how the situation was in Bhutan, and also how the governments have reflected, and how the situation right now is in Bhutan and in South Asia in general. Pasang? Pasang, are you there? Okay, now looks like Pasang is having some problem there. Maybe I will go to Manohara. Manohara, can you tell us what it is, how you can relate this to Nepal, and how do you reflect on this situation of COVID-19 in Nepal? Manohara?
Hello, hi.
Yeah.
Hi, Makala. Hi.
Go ahead.
Yes, thank you so much. Talking about the COVID situation in Nepal, until now we have more than 150 50K of the total cases. We have recovery rate is still the lower, I guess, around 69% is recovery. Most of the people, the COVID case is very much spreading in the city and the lower part of Nepal, although there are few areas geographic where there is no COVID. And this is because in those areas where COVID cases are spreading, it's because of movement of people from a cross-border, and also because of the movement of people from one district to other for the business point of view. Because of also return migrant visiting to home, and this has also impact on the cases. So talking about the COVID, it really linked to the water. That's why the today discussion, we really wanted to highlight some of the reflection in the isolation, and also in the camp, most of the camp in the area where government have been managing, it's not much water is there. Although water is there, but safe water is a key issue for hand washing and other facility. This is the one of the challenge. And another good part of this, how government is responding, is that Nepal has really it's good in the sense that political governance system has been changed, unlike in the 2015. Until 2015, we have a one system of governance, like a unitary, Kathmandu centric, top down development practices, thinking, planning, so on. So since we have a new constitution that really institutionalized federalism, which is a three-tier of government, we have equally responsibility and also role to contribute, role to the development, and also providing public services from the lowest unit with the local government or municipal. If we look at the change in terms of at least the service, relief services, local government, we found that local government is really the good in place in order to reach out the people and to inform and also disseminate information about the COVID cases and health protocol, hygiene and health protocol. They are trying their best to provide, to reach out the affected people, but still we are in the transition to fully institutionalized. Although institution-wise there are three levels of government. Local government is really the powerful entity in the new system, who have a power and also responsibility to take care of the people who are closest to their constitution. So in that context, they are trying their best to provide services, but they also feel that in our discussion, our research, one of the question is that how they are trying to respond these COVID cases, and they mention us that three things. They are trying their best, but because still the resource in terms of financial resource, technical capacity, human resource are not there, especially in rural area. Municipal office is just running by few staff. They don't have full staff to consider to support services, both in health services and also other water supply system services. So one challenge at the moment is that they are not able to provide sufficient services to the people, and also because of human resource, because of financial resource. And technical wise, they are along compared to municipality in city. Municipality in rural area is really far away because they don't have a much access to the technology also, like a webinar. The government is trying to disseminate a lot of discussion, information around COVID and health protocol, how the future should look like. A lot of cases in the rural area, because of not having access to internet connection, well connection, them some of the group are also structurally marginalized. So in that context, and we also did, government is trying to analyze how COVID has impacted the people, especially women who are in an informal job, informal market, and their product during the lockdown, they were the one most affected, including among the women. People with a disability, women are much affected because of accessibility issue, because of their social connection network is weak, and because still the way society see the people with disability is really very much not traditional. I mean, it's very it's not supportive, I would say. So in that context, most affected people who are feeling challenged because of COVID in Nepal context, especially rural Nepal context, women, girls, people with disability, marginal people who have a limited access to
Thank you.
services.
Thank you, Manohara.
Yes.
Sorry, I
Yes.
have to stop just to give an
Yes.
opportunity to the
Yes.
other panelists as we are also
Yes, sure,
running
sure.
shortage of time.
Sure.
I'll come back to you again.
Sure.
Can I go to Kendra? Looks like Pasang. I don't know whether you can hear me, Pasang. Pasang? Maybe quickly, Kendra, can you just reflect a little bit, or you have any question to Jenna or Aaron on the discussion they had?
Yeah, I'll only point out, and Clarissa has made this point also in the chat, that this issue of governance and providing a strong foundation for addressing it is critically important. And we talked, there was a large discussion with the government official from Ethiopia and some of the other African countries, and they share some of those exact same types of challenges. So this governance challenge is one that we really need to take on, and we really need to work to make sure that the right institutional framework is there to address some of these challenges.
And it also was very informative in the discussions in that panel, where the countries have responded positively and increased the budget allocations for hand washing and also for the entire wash as such. I think it is very interesting and heartening to know, but there are other countries on this side of the world where the budget cuts are there, and then the most probably it's going to be on the water and sanitation. So we are kind of, because the country's economy is slowing, and then we are more scared now how that would impact on the water and sanitation budget. So that's another other way of doing things in here in South Asia. I still haven't found Pasang. Pasang, can you hear me? Maybe I'll go to Manita. Manita, can you tell me a little bit more about your reflections on what Aaron and Jenna was sharing?
Thank you, Sneha. So when we're having this discussion, I was just reflecting on a research project that we're doing that's funded by Water for Women, where we're trying to look at how water access is linked with wealth and power. And we're trying to examine gender and social dynamics around how water access is structured around the power structure that pre-exists in different contexts. So the systematic inequity that was discussed in the project, I think comes in some of the research sites that we have, where there is the science behind it in terms of use of disinfectants and use of water to help yourself prevent from getting infected from the virus. But the contextual reality is in Nepal is as such that a lot of households access water from shared water pumps or hand pumps or taps. So in our research findings, what we saw was that a lot of resourceful households are able to seek alternatives and connect private connections. So it's easier for them to not use these shared pumps. So a lot of campaigns were around, not being mobile or not going out and practice social distancing. But for a lot of households, there was this really a question of, are they supposed to meet livelihood challenges, or are they supposed to go to this shared hand pump infrastructure to access water? In one of the discussions that we had this month, some of the water users were sharing with us as to how there are some kind of discriminations around that, because in one way the government is trying to provide them with soaps, but if there's no water in their immediate access, how do they use that, or how do they prevent themselves? So this was a question that really struck us and kind of matched with our research that we're doing as well. It really says that unless water access is addressed from the equity point of view, and unless the government bodies try to address that. Maybe no one should be left behind. The idea that's there may not be fully achieved. So yeah, I think I'll also share a link of a newspaper article that we've written around that so that everyone can have a detailed idea of what I'm talking about. But for now, I think, yeah, that's the thing that I'd like to highlight, which is the equity aspect of COVID prevention. That's vital so that we actually leave no one behind. Thank you.
Thank you. Thank you, Manita. That was wonderful. Very good insights. I think when it comes to the leaving no one behind are the most vulnerable, I think these were the hard hit. We have been having research studies doing on different types of vulnerable groups and how they have impacted. And their situation is really, really bad. Whether it is, they cannot even apply any of the social norms that we are talking about. And then the plight of the sanitation workers was even worse. A lot of them, even working in utilities, were not getting any of these masks or sanitizers or even gloves for that matter, and exposing themselves to the disease. I think their vulnerability has increased in this COVID time. And similarly, all these vulnerable groups that we are talking about, be it is urban homeless or urban shanty dwellers are physically challenged. Their situation was worse. And then a lot of people also expressed that there was violence and frustration, and there were people who were suffering with low levels of motivation and all those things. So those were other reflections that have come from the field studies when we looked at what are the issues for these vulnerable groups. I think that is very, very important, the equity, and then how do we address these issues. I think for that, again, as it is, we have left them. And in this COVID pandemic, this group has become even more vulnerable. I think that's very, very important point that we need to reflect on. Let me see if Pasang is there at least now. Pasang, can you hear me? I see he's unmuted. Yes, Pasang.
Yes, Nia, sorry, I'm so sorry.
Yeah, that's okay. Please go ahead. I was just asking the situation of COVID in Nepal, and
please
then,
update me a little bit. Oh,
can you hear me?
can you
Pasang?
hear me? Yes, I can hear you well.
Yeah, we can hear you. I was just asking how is the COVID situation in Bhutan and how the government has responded and contained. And then if you have any reflections on the content shared by Aaron and Jenna, you can just reflect on those.
Okay. Good morning, everybody. I'm so sorry today. I'm not able to give my full attention because two things happening here. One is a seminar which I'm heading here for youth centers in Bhutan. So all the managers of youth centers have come here to learn about how to manage their toilets from us. So we are organizing a 3-day workshop, and they are here right now in the other hall. The other thing is, unfortunately, my aunt passed away, and funeral is happening today. So I am unable to attend the funeral because of my commitments here. But I promise to be come to the cremation ground as and when I finish here. But the happiest part is the story I want to share about Bhutan's fight against COVID, which is, I think, by far the best in the world. We are very fortunate to have good leadership here, enlightened leadership. First of all, is our king, who is not only a very enlightened being, but also very concerned, smart, and well-educated, who knows about these things. Secondly, we had the luck that the last election, a doctor won the election, and he's the prime minister. So, our prime minister is also a doctor. Our health minister is an epidemiologist who knows about this. So when COVID came, when the world is counting the positive cases in thousands, as of today, we only have 330 or so cases, 0 death, and recovered over 300. So we, for maybe active cases, about 30 or so. I need to get the latest figure today, but ours is so negligible compared to anywhere else in South Asia or the world. And the fact that we able to keep it the death to zero is amazing. And the another story I want to share with the world, colleagues here, is that healthcare is free in Bhutan. Quarantine, we are able to contain. Governments respond to imported cases because we do not have community transmission. So when people from outside come in fact, we are evacuating our Bhutanese from all over the world. And as we evacuate, as they land in, they are given 3-star hotels, accommodation, quarantine, and our quarantine duration is amazing, 21 days, because we learned from earlier quarantine that after 14 days there are some cases. So we're studying from world's mistake, and here we are giving 21 days quarantine. And despite that, we have one leakage and we had to go under a lockdown once, but we contained it. And today, I think Bhutan has the best situation. We wish this to the rest of the world. We want other countries to also be able to contain COVID like we did. So we are very grateful to our government. And the first case stories you can read later on, that our first case was an American tourist who was here. And in fact, he was very old and still he survived. We saved him. And when he was airlifted to America after some time, American doctors found out that Bhutan has taken very good care of him. In fact, they were amazed that we could keep him alive. So such is the situation. And everybody is enjoying free treatment, test, and by per capita, I think we must be one of the highest in terms of testing. And now talking about COVID, now citizens are coming forward to raise fund, even though government will surely give, when the vaccine comes, everybody will get free vaccine, but still citizens are already forming groups, taking responsibility to raise funds to make sure that everybody gets free. The citizens can come up and help government pay for the vaccine for everybody. So such initiatives are coming. And Bhutan's story is beautiful, and I wish I had a lot of time to talk about this. And if I had a better, focus today. Thank you so much, Sneha. I think I will leave at this.
Yeah, thank you, Pasang. I think that's a very, very good story about Bhutan and how Bhutan is tackling. It's very, very heartening to know how people are contributing to come forward and do support to get the vaccine in for everyone. Now I will move back to Aaron now. Aaron, can you look at some of the questions, and then can we just see take one or two questions so that you can answer them, and then we will move towards the end.
There were a couple of questions on the importance, of course, of hand hygiene and washing. Of course, I think we all agree, absolutely, essential, right? Hand washing is a no regret solution, so to speak, to disease prevention. That said, it's really hard to differentiate the impacts of just wash, to assess the impacts of just washing your hands, because we haven't really been able to do a study where you can isolate the impact of hand washing from lots of other things dealing with COVID-19. And so it's really hard for us to say that, this is how much that one intervention impacted the spread of the disease or the transmission. But look, I think there's no question that this is something that we need to continue to push for, especially in, I think Jenna's point about kids and those kinds of environments, schools, healthcare facilities, all those types of environments where you're in contact with lots of people. Hand washing is critical. I don't know, Jenna, have you looked at some of the other questions here too?
Yeah, Jenna, I was about to move it to you. People would like to know about the vaccine and probable time of when that is coming, or
No, I did not hear any discussion of the vaccine today. I could have missed it. Aaron, I don't know if you did. And my understanding is that, there are literally dozens in development, but I don't know, for example, how many are in efficacy trial at this point, right? Who have proceeded beyond safety trials. So I'm sorry, I'm not a good source of information here.
Yeah, I think that's fair. There were two issues that did come up, I think, around around COVID and the vaccines. One was that it was unclear that if you get COVID, that you will then be immune to getting it a second time. That you may have some immunity, but that immunity may only last for a short period. So it may be possible for people to get reinfected after a period of time passes. And that was an interesting finding. And I think with the vaccines, you know, for them to be effective, you need to be able to vaccinate a large number of people. And so there were some real questions around our ability to be able to do that and to mobilize, you know, a vaccine at the levels that are going to be necessary to confer that type of protection among communities. So I think we're going to be stuck with hand washing and a lot of other interventions for quite some time.
All right. I think someone is mentioning about the multi-stakeholder platforms. Yes, they are very, very important at this particular point of hour. I think that's the need for the government. It's the governments can do, but I think joining hands with governments by all the sector stakeholders, be it is donors, be it is civil society organizations. I think we all have to move and work together. And of course, in this context, the research organizations also play a very, very important role to bring in the information at the right time to take the right kind of decisions. I think the multi-stakeholder platforms are going to be the future decision-making units for us to provide way forward. I think that's very, very important to note those ideas. Aaron, would you like to respond on how the public health sector working in coordination with other agencies? Were there any discussions on those kind of aspects?
There were. I think a lot of people recognize that this is a challenge that's going to require really an integrated response. I mean, I think we all know that WASH interventions are just one part of providing an environment that's safe for people to live in. And that you really need to, whether it's a school, a healthcare facility, or at home, you need a range of interventions to ensure that you've got the right environmental health conditions working. And so we have to work in partnership with many other people. If you think you're delivering just WASH services, but you're not dealing with livestock properly, or you're not dealing with, if you're in a hospital setting, if you don't have energy for sterilization and equipment, and you're not training healthcare workers, you're not going to achieve the results that you want to achieve. So these kinds of integrated, multi-sectoral approaches, I think, are going to be absolutely essential. I don't know, Jenna, you've done some more work on this kind of issues.
Thank you. I think that's very, very important, Aaron, to take away those lessons from the conference. And we are actually over 1 hour into this discussion. We never realized how interesting this is going on, that we passed on the time and still patiently all our audience are there. However, I think we have to come to an end, and then we will bring you tomorrow another interesting story. But for today's, Aaron, what are your final remarks for the day?
No, just thank you so much for your interest and your interest in the conference. Again, there's a ton of content that's recorded. You'll hear it from them and straight from the experts. You'll have a chance tomorrow night to talk to I think, I don't remember if Joe's tomorrow night or if Clarissa's tomorrow night, but you'll have a chance to talk to other experts. So please join us again for the next couple of days.
Yeah, thanks, Aaron. That was fantastic. Thanks, Jenna. Thanks to all my guests who were on this show. I think it was very, very interesting. And then thanks for providing so much information. I'm sure colleagues at our end in this South Asia and Pacific would have benefited from this talk show. We will give you more feedback on what happened on this day tomorrow in the show. And my colleague Murli Ramisetti will be there tomorrow to co-host you all, and we'll have Clarissa. So it's going to be yet another interesting story tomorrow. So we look forward to listen to you tomorrow. And thanks everyone for all your time. Thank you very much. Thanks a lot, Catherine, for all that background. Thank you very much.
No, thank you so much for doing everything and setting it all up. And thank you to all the other panelists and Kendra as well for helping with this. We really appreciate it.
Yes. Thank you.
Take care. Have a great day.
Thanks, everyone.
Have a great evening. I think you had such a long day, Jenna and Aaron, Catherine, everyone. Thank you.
An exciting day. We were happy to do it. So I'm so glad that we were able to talk to you guys. So